Our first speaker comes to us on behalf of MAPS, the Multidisciplinary Association for Psychedelic Studies, founded in 1986. MAPS is a nonprofit research and educational organization that aims to make psychedelics and marijuana available safely and legally to users. Joining us today is Development Officer Liana Gillooly. Welcome, Liana.
Thank you so much. Thank you for hosting this. I feel honored to have been invited. And congratulations on this event coming together in such a beautiful way. My name is Liana Gillooly, as it was mentioned, and I have the great pleasure of serving the Multidisciplinary Association of Psychedelic Studies as Development Officer, where my duties are to raise the funds needed for our organization's success and to transmit the message and the mission of this organization to audiences like you. Since there's a lot to cover in 20 minutes, I won't go into the details of my own background, yet I'm hoping that today's presentation can give you a better sense as to why I have chosen to put my energy into MAPS and to serve on the board of another nonprofit I founded called North Star, which aims to ensure that for-profit businesses forming in the field of psychedelics do so ethically and understand the opportunity to be as transformational in their business approaches as psychedelics can be for mental health. Today, I'm going to present the story and vision of MAPS in hopes of relaying to you how MAPS's theory of change stands to impact millions of people around the world. MAPS's history is intrinsically connected with the drug war, as Rick Doblin would not have started this organization had the DEA not moved to schedule MDMA in 1985, 15 years after the Controlled Substances Act made most of the other classic psychedelics a Schedule I substance. Rick started MAPS as a nonprofit psychedelic pharmaceutical company in its effort to bring back MDMA through science, medicine, and FDA drug development process so that he could prove what he already knew to be true, that MDMA was a powerful adjunct to therapy and could heal trauma. While MAPS is best known for our work in pioneering psychedelic-assisted therapy, namely through our Phase 3 program, taking MDMA therapy for the treatment of PTSD through the FDA process, MAPS as an organization has a much broader scope, which is to develop the medical, legal, and cultural context for people to benefit from the careful uses of psychedelics and marijuana. Underlying this mission is a strong ethos of compassion and justice that has been cultivated over decades. I will get to updates on our Phase 3 research, yet I'd like to begin with providing the context, or the set and setting, if you will, in which we are bringing this breakthrough new paradigm in mental health to the world. MAPS recently updated our 7 principles, which embody the deeper purpose of this organization. In Healing for All, we proactively work to overcome cultural, legal, and economic barriers to equitable psychedelic access. In prioritizing public benefit, we work for the good of our collective humanity and planet over organizational or individual gain. We practice open science and open books where we commit to sharing what we have learned, including our findings, our protocols, and our finances. We really see ourselves as a public utility. Transparency creates a culture of accountability and contributes to the public domain, promoting ethical collaboration toward a greater shared purpose. With set and setting and integrate, we approach everything we do like a journey, with clear intention, a resolve to face our shadow, and a recognition that integration is an ongoing process. Compassion, not criminalization, means that we advocate for the dignity and the rights of people who use drugs, free from fear and stigma. We firmly reject the criminalization of people for growing, making, distributing, or using drugs. With Be the Bridge, we build common ground between the medical, the mystical, the marginalized, and the mainstream. And finally, choosing collaboration helps us to advance faster than being in competition. And we put these principles in action through research and development, our public and professional education and training programs, our policy and advocacy, and our harm reduction initiative. Now, when we say healing for all, we really mean it. And to catalyze this, we are centering equitable access to MDMA-assisted therapy as a core to MAPS's mission. MAPS is committed to creating pathways to access for those historically marginalized by the mental health field and society at large. And our health equity initiatives have been underway for years. To date, we have done things like train therapists of color so that in the event of FDA approval, they're among the first to be able to provide care to the communities that they serve. Our commercialization plans include key performance indicators so that equity-based key performance indicators so that we can hold ourselves accountable as we unfurl access across the world. And we cannot improve public health outcomes without ending the war on drugs. These two are inextricably linked, for anyone who's caught in the criminal justice system has worse mental health outcomes. And as you might have noticed in the last election, every drug policy reform initiative on the ballot in the United States, including the decriminalization of all drugs in the state of Oregon, passed. Go drugs. Our team provided their expertise to the leaders of those initiatives and most recently consulted Senator Scott Wiener's staffers on the bill that was introduced last week in California to decriminalize all psychedelics in the state, including MDMA. MAPS perceives that there are many appropriate contexts to safely and legally experience the benefits of psychedelics, not just through the medicalization of these substances. And while some might argue that legalizing MDMA might cut into our market share, we are committed to ending the war on drugs and envisioning a future where drugs are rationally regulated according to their potential benefits and harms. Now, as we are pushing to end prohibition, the Zendo Project is developing a public health framework for a post-prohibition world. For those of you who might be unaware of this MAPS initiative, the Zendo Project has provided support for thousands of people having difficult or challenging experiences with psychedelics in environments like music festivals and events, including Burning Man, since 2012. The vast majority of people who take psychedelics currently do so out of a clinical, therapeutic, or ceremonial environment. Psychedelic research and the exploration of its therapeutic potential during the mid-20th century was disrupted and impacted in no small way by the inability of the psychedelic movement to effectively address and navigate adverse psychedelic experiences. We must do better this time around. And by providing adequate education, information, and tools to help our society deal with the complex psychological and emotional territory of the psychedelic experience. Plus, we are ensuring that we can integrate and onboard society into safely interacting with these substances. This will only help de-risk the massive investment that is being made into psychedelic drug development. So I'm excited to share here that Zendo is piloting a program in the city of Denver to train their first responders, including their police force, on how to mitigate a psychedelic emergency. This is a first of its kind program, and if we can help municipalities understand what it means to manage a public with access to legal psychedelics, we can further reduce stigma and create more possibilities to end failed drug policies. Now that you know a bit more about how MAPS is approaching our work and some of our ethos, I'm excited to share more about the main thrust of our work, which is that we are making MDMA-assisted therapy into a prescription medicine. And while we're at it, we're ushering in a paradigm shift in the field of mental health. While Rick started to push to research MDMA in 1985, it took meeting Michael Mithofer in 2002 to really get things going. From there, it was another 12 years until the completion of an international series of 6 phase 2 pilot studies of MDMA therapy for PTSD. Here's the image after the meeting our dream team had with FDA, where they were approved to go to phase 3, becoming the first psychedelic assisted therapy to get to phase 3 in any government regulatory agency around the world. In the year before phase 2 was completed, when Rick and the MAPS team realized that if they were successful in the phase 3 trial, they would have a drug product they could sell at the end of the day. So they decided to found the MAPS Public Benefit Corporation, also known as MPBC, and place Amy Emerson, who has extensive pharma background and had been leading the phase 2 research, at the helm as CEO. MAPS is a wholly owned subsidiary of MPBC is a wholly owned subsidiary of MAPS, with the special purpose to balance income from the legal sales of MDMA with the social benefits of MAPS's mission. Now, all the drug development, the commercialization, and therapist training activities fall under the scope of MPBC. MPBC will sell MDMA to therapists, and money from sales will cover operational costs of MPBC and the cost of our clinical trials. Any leftover profit goes back into the only shareholder of MPBC, which is MAPS. MAPS uses these profits to then fund additional studies within MPBC and also within future wholly owned subsidiaries. So long as MAPS and MPBC are funded by donations without having to return profits to investors, we can set a standard of good behavior and act as a check on profit maximizing for-profits by being a shining counterexample through orienting ourselves to maximize public benefit over profit. Now, to give you an idea of why we are focused on PTSD research, let's take a look at the numbers. There are 8 million people in the USA who suffer with PTSD and 350 million people globally. And 2/3 of people do not adequately respond to the currently available treatments. When Rick determined to focus on PTSD, it was because he knew that MDMA was effective in treating it. He was building off a body of work with people who came before, like the secret chief psychiatrist Leo Zeff, who gave MDMA to hundreds of therapists to use in their practice and witnessed its efficacy in treating trauma before MDMA was made illegal in 1985. And it was through all of those experimentations that this study design was developed. As you can see here, this is our protocol. There are 3 8-hour psychotherapy sessions with MDMA and 2 facilitators. There's an additional 12 preparation and integration sessions, and all of this happens over a course of 3.5 months. And in terms of training for therapists, there's a 90 hours of training with 30 hours of supervision. And MDMA will not be made available as an over-the-counter drug. It will be an inpatient service that is provided. So this is our exciting update. The first of 2 phase 3 trials of MDMA-assisted psychotherapy was completed in mid-2020, and the data is still undergoing final analysis in preparation for publication of a peer-reviewed article in the coming months. As a matter of scientific integrity, MAPS and MAPS Public Benefit Corporation will not be providing any additional comments regarding the results prior to publication. But here's what I can share with you. MAP1 was statistically significant. This means that there was enough participants to determine that the results were not by chance, and it is therefore considered a successful phase 3 study. There was also no unexpected or serious safety signals that emerged during the course of this trial, which is a key indicator that the FDA looks for when approving new drugs. This means that we are on track for our goal of obtaining FDA approval if we can complete the second of our phase 3 trials and any other of the associated safety studies that the FDA has required. So with a treatment, while I can't share with you the results of our MAP1 study, I can share with you the results of our phase 2 studies. As you can see here, this is our placebo control group that showed a 23% of people no longer met the criteria for a PTSD diagnosis at the 2-month follow-up. This is when you add MDMA, that number jumps to 56% of people no longer meeting the criteria for a PTSD diagnosis. Now, at the 1-year follow-up, that number jumps again to 68% of people. Now, considering that 2/3 of people do not adequately respond to treatment, this is quite a significant finding. And also it's interesting that people seem to continue to improve even after our teams stop working with them, which this is 12 months after our team stopped working with them. As you can see here, the currently available pharmacological interventions for PTSD have trivial to medium effect sizes. And our phase 2 showed that MAPS MDMA-assisted psychotherapy had a 0.8 effect size, which is also quite significant. So this is our pathway forward. We are expecting to we're already enrolling and screening patients for MAP2, which is our second of the 2 phase 3 trials. We plan, if all goes well, to do a new drug application. And if all goes well, and this is subject to change, we've definitely experienced some delays because of COVID. And so if all goes well, we're expecting approval by Q2 of 2023. Now, if you see in the bottom here, we're also expecting European Medicines Agency approval by 2024. So this brings me to the next thing that we're focused on. As you recall, there are 350 million people suffering with PTSD worldwide. And with the treatment so promising and a need so extraordinary, we're committed to taking the necessary steps to expand our reach to the rest of the world. Our global expansion plans were already baked into our current FDA trials, as our studies are happening in 15 sites in 3 countries, including Israel and Canada. Success in FDA will unlock approvals in those other countries as well. In 2018, MAPS met with the European Medicines Agency and got approval from EMA to use our FDA data towards our approval process in Europe. So now we are doing a lead-in phase 2 trials slated to begin this year. Therefore, obtaining approval in Europe will quickly help us reach more patients in multiple European countries. And additionally, it will help us unlock our ability to apply for regulatory approval in most other countries in the world, many without the need for additional studies. We have already made significant progress and initiated training and research in several other countries across the world. And we do this all through a wholly public benefit model, which has already created a tremendous amount of value and innovations in the last 35 years. Without the constraint of producing short-term profits for just a few individuals, we can take risks, we can follow science, we can focus on healing and improving outcomes, and we can think longer term. I'm not sure that a typical business would have pursued research into MDMA 35 years ago. And while it might not be a business as usual to combine a not-for-profit education and advocacy organization with a world-class drug development organization, we see this as a perfect combination to create the most amount of high-leverage impact in society. And we had to do this because the old pharma model is just not getting it done. Suicide rates in the US have been steadily increasing despite a substantial increase in the spend on psychiatric drugs. It is clear that the way the pharmaceutical industry understands and treats mental disorders is deeply insufficient. They invest billions into research and marketing for new drugs, yet are limited in their ability to produce long-term and meaningful benefits for everyone because of a narrow focus on producing returns for individual shareholders. While this might be an effective form for many businesses, it has been lacking in producing lasting public health outcomes for citizens. One example of this problem is ketamine, which was already legal and already could be prescribed off-label for depression and is very, very cheap. And ketamine-assisted therapy is a very promising treatment which could treat the root causes of disorders. But that's not the format that Janssen went after when developing their derivative drug product Spravato, because adding therapy to the treatment as part of the delivery of the drug was an expensive barrier to market. So instead, we have a company charging upwards of $800 per dose for a drug that has been around for decades and costs providers under $3 per dose. So at MAPS, we aim to do something else that traditional pharma companies do not do, which is focus on addressing root causes. We're not interested in creating a medicine that just treats symptoms, even if it makes more money to have patients on our drug on an ongoing basis. Our finite protocol might limit our upside, but the upside for our patients is immeasurable. And we are building something else most pharma companies fail at, which is building public trust. And this is going to be important as we try to lead an entire new industry emerging from our work. Because we don't have to worry about market share, we don't have competitors, just potential partners. We are going to work with for-profit and nonprofits alike. And we understand that a growing field means more healing for all, and we hope to help others do things right. And this all leads us back to our master plan to create a sustainability engine. We're going to be first to market, expand our work globally, and then take advantage of our revenues to fund future research. So this is what we are building together, a wholly public benefit model that is regenerative, sustainable, and risk-taking. This is an organization whose only goal is to increase benefits for the public and further MAPS's mission. And this is the vision of the future, a world with ample access to culturally informed psychedelic therapy, where therapists are cross-trained in multiple modalities and where the root causes of our human suffering can finally be addressed. And I'd like to end on this quote from Stan Grof, yet also mention something else Stan said. And I should mention that Stan is a mentor and a pioneer of this field who's deeply influenced Rick Doblin and therefore MAPS as a whole. Stan calls psychedelics and non-specific amplifiers of the unconscious. And with that in mind, I'd like us to invite us here today to consider what might be lurking in our unconscious so that we may carefully choose what we are amplifying as we build this new field together. Thank you so much.